Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and this entire podcast is what to do about celiac disease. And is there any hope for people who are sensitive to gluten anytime they eat it or have rashes on their body, autoimmune diseases they've been diagnosed with? If you know somebody who has been diagnosed with celiac, if you yourself struggle to consume gluten in your food, which is a very dense protein found in a lot of grains. If you know anybody struggling with celiac, this show is for them. So please share this with them, because what you're told by the medical profession is there's no cure for them. There's nothing that can be done, when in fact, researchers and medical science papers all around the world have already confirmed there are many things you can do to improve the likelihood of people having worse symptoms with celiac disease, improving their gluten reaction so they don't react to it anymore. And I'm going to show you all the research. What has been published by medical science is the known cure and those things that people can supplement to improve gluten sensitivity and ultimately reverse their celiac disease. And can it be reversed? You better believe it. Does the medical profession believe it? No, they don't. So we're going to teach you what it is the medical profession says about celiac disease, and then what the Dr. Ardis Show and what our research that we've put together for you says about celiac disease, and the hope for all of you, the millions around the world suffering with celiac. This show's for you. I have a PowerPoint presentation. We're going to take you through it right now so you can see the highlighted research statements and promises and hope found in medical research to beat celiac symptoms. It's going to be amazing. I hope you love it. Remember, you go to the resources tab of the drardisnishow.com and download this entire PowerPoint for free. You just go in there and download it. It's a PDF, and you can go share it with anybody you know who has celiac, so they can see the research and learn themselves of the hope that lies within the presentations we give you here at the Dr. Ardis Show. So let's dive in. Everything you need to know about celiac. All right, reversing celiac and gluten sensitivity. Let's see what the research says. First, this is a QR code. Scan it, put in your email. We will notify you when our next presentation is ready. Once a week, I actually dive into a health topic of some sort, interview a guest, talk about a health scenario or a medical diagnosis, and what is the truth about the hope that lies within nature's healing principles. That's what this QR code is for. If you want to be notified, put in your email when you scan that code, and you'll be notified each week of our free podcast that we do. All right, let's start with Celiac Disease Foundation. They might know something about celiac. What is celiac disease? Well, they write that celiac disease is a serious autoimmune disease that occurs in genetically predisposed people, which I think everybody has genes inside of them, where the ingestion of gluten leads to damage in the small intestine. It's estimated to affect 1 in 100 people worldwide, but they state only about 30% of people are accurately diagnosed and properly diagnosed to have celiac. So what they're saying is 70% of people with celiac issues and gluten sensitivity, they don't even know they have this problem. So what is celiac disease per the Celiac Disease Foundation? When people with celiac disease eat gluten, a protein found in wheat, rye, and barley, their body mounts an immune response that attacks the small intestine. These attacks lead to damage on the villi. These are small finger-like projections that line the small intestine that promote nutrient absorption from the food you eat. When the villi, these little finger-like projections, get damaged, nutrients cannot be absorbed properly into the body. Therefore, what would be the complication? You become nutritionally deficient, and you will develop every symptom and disease on earth. Now let's go to medstarhealth.com.org. What do they state about celiac disease? Well, they show you the pictures of those little villi in your small intestine. This is when people have celiac disease and are gluten sensitive. They describe it here and what those little villi look like. This is how they describe celiac disease. It is an autoimmune disorder that can develop at any point in life, from infancy to adulthood. It's different from gluten intolerance, celiac disease is, which is a sensitivity to foods with gluten. Celiac disease and gluten intolerance symptoms may both involve digestive discomfort, such as bloating or diarrhea. However, gluten sensitivity won't cause your body to attack itself, they say. That's the difference between celiac and gluten. Gluten, you might just react to gluten. Celiac, you have an autoimmune response. Your body is literally killing cells in the intestines. Penn State, University of Pennsylvania, Penn Medicine, they published their definition of celiac disease. Celiac disease is a autoimmune condition that damages the lining of the small intestine. This damage comes from a reaction to eating gluten, they say. Pretty uniform what the definition of celiac disease is. The treatment per University of Penn Medicine. Celiac disease cannot be cured. Wow. So the medical profession still cannot cure you of celiac disease. Your symptoms will go away, and the villi in the intestines, those little finger-like projections, will heal, they say, if you follow a lifelong gluten-free diet. Now, I'm not saying it's a bad idea. I'm just telling you what Penn Medicine is saying. The only way to fix this is to avoid gluten the rest of your life. This is the Mayo Clinic. What's the Mayo Clinic say about celiac disease? They got plenty to say too. So let's dive into what they want you to know. With refractory celiac disease, the small intestine doesn't heal, they say. Refractory celiac disease can be quite serious, and there is currently no proven treatment for celiac disease. Just want to reinforce what the Mayo Clinic and what the Cleveland Clinic and what everybody's telling you. So also what you should know, celiac.org has published this 20 things you need to know about celiac disease. So if you have celiac, you will know these things. If you are supporting someone you know or love that has celiac disease, this is what they're suffering with. This is last updated 2022. So let's read together. 1 in 100 people worldwide have celiac disease. The next thing, celiac disease affects an estimated 3 million Americans. So this podcast needs to be watched by 3 million people. Approximately 60 to 70% of Americans with celiac disease are not diagnosed and are needlessly suffering, they state. More children have celiac disease than Crohn's disease, ulcerative colitis, and cystic fibrosis combined. There's a lot of grandkids, a lot of nieces and nephews out there, a lot of children of yours that may suffer with gluten sensitivity. This podcast is for them. Celiac disease can affect every organ in your body. I bet you all thought it was just a small intestine disease. Approximately half of diagnosed patients still report symptoms while on a gluten-free diet. So even if you only avoid gluten, as has been recommended by medical associations I just showed you, the only way to beat it is a lifelong gluten-free sensitivity diet. Did you know that even if you live gluten-free, 50% of all people with this disease will still have gluten symptoms? There's an average delay of 6 to 10 years for an accurate celiac disease diagnosis. From the time you start having symptoms, it's going to take them 6 to 10 years on average to diagnose you accurately. It's a long time. Without a timely diagnosis, celiac disease can lead to intestinal cancers, type 1 diabetes, osteoporosis, thyroid disease, multiple sclerosis, anemia, infertility and miscarriage, epilepsy, seizures, and more. There's more than 200 symptoms associated with celiac disease, they report. The later the age of celiac disease diagnosis, the greater the chance of developing another autoimmune disease. People with celiac disease have an increased incidence of microscopic colitis, inflammation of their stomach, and inflammatory bowel disease, Crohn's disease, and ulcerative colitis. People recently diagnosed with celiac disease are commonly deficient in these things. Take note, those who have celiac disease and have been diagnosed with it after their 6 to 10 years of suffering, they often have a deficiency in fiber, a deficiency in iron, a deficiency in calcium, a deficiency in magnesium, a deficiency in zinc, a deficiency in folate, which is vitamin B9, a deficiency in niacin, which is vitamin B3, deficiency in riboflavin, which is vitamin B2, a deficiency in vitamin B12, and vitamin D. Well, before I even continue with this presentation, you now know what it is your people with celiac disease should be supplementing. They should be supplementing iron, calcium, magnesium, zinc, folate, niacin, riboflavin, vitamin B12, and vitamin D. All of these are found in bee pollen, by the way. They're also in my Doc's Healthy Kids supplement, just so you know. All of those are in it. So there's a basic starting point. This is Salon Editorial, salon.com. Celiac disease numbers keep going up. Yet, due to lack of funding, researchers still aren't sure why. Okay, this is awesome. When I read this title, I was like, oh my God, how ridiculous is this? So researchers have still not figured out why celiac is affecting millions of people around the world. And they're blaming it on a lack of funding to do the research. Okay, I just have to tell you guys, billions of dollars has been spent researching celiac, and there's still no understanding about what causes it or how to cure it. And these medical establishments like the Mayo Clinic, gastroenterology associations, the Foundation for Celiac, they're still telling you there is no cure. There's already been billions of dollars funded into research. That's not the reason. They're not looking for the cause. At the Dr. Artist Show, I can tell you what's causing it. Everybody I've ever seen that had celiac disease all had parasites, just so you know, in their intestines. And it took 2 to 3 months to clear it all out and then restore them back to health. Now, they say there is no cure to celiac disease. This is what the medical profession is going to tell you. So what are the prescribed medications that they're going to prescribe everybody who has celiacs? Outside of telling you just avoid gluten foods, what's the drugs they prescribe? Well, there's a list. Let's go through them. This is the Celiac Disease Foundation. They state there's only a lifelong adherence to the gluten-free diet. This is the only treatment for celiac disease. That's what they tell you. This means avoiding foods and beverages that have gluten, which is a protein found in wheat, rye, and barley. Just so you know. So let's go to what is the options for those. If you go to the Advanced Functional Medicine website, advancedfunctionalmedicine.com, the negative side effects of a gluten-free diet. So even if you do live the gluten-free diet, what are the downsides? Well, there are some. Would you like to know what they are? You may not be getting all the nutrients you need. This is the first possible named negative effect of a gluten-free diet. Enriched wheat flour products are a good source of iron and B vitamins. But when you avoid gluten foods, you're not going to get iron and B vitamins. And I just showed you the research study claiming that fiber, vitamin B6, B12, B3, B2 are all deficient. And iron is found deficient in those that are on gluten-free diets. It may disrupt your gut microbiome when you go just gluten-free. Just so you know, wheat is a good source of prebiotics, which are essential for gut health. They're making sure you're aware of. A gluten-free diet may lead to a fat gain, just so you know. All of you who go on a fat-free diet, those of you with lupus, developing celiacs, all of you will put on weight. And it's usually because you go gluten-free. Recent studies they announce here on advancedfunctionalmedicine.com. A gluten-free diet may lead to fat gain. They state recent studies show an association between people who are on a fat, gluten-free diet and weight gain, and subsequently the risk of cardiovascular disease and type 2 diabetes on a gluten-free diet. There's a high acellular carb content, lots of carbs in gluten-free replacement foods that may cause excess weight gain. The Mayo Clinic, celiac disease, they published medications that can control intestinal inflammation. If your small intestine is severely damaged or you have refractory celiac disease, steroids may be recommended to control inflammation. Other drugs they mentioned at the bottom, such as azathioprine, Asazin, or Imurin, which are the brand names, or budesonide, which is a corticosteroid inhaler, might be used to help people with celiacs. Well, let's go over budesonide's published risks. So this is from drugs.com. Those of you who have celiacs, if your loved one or gluten intolerant, have been prescribed budesonide as an inhaler or as a nebulized agent. I just need you to be aware, these are some of the side effects of budesonide. You should know what these are. If you take budesonide, it has a published very common side effect to cause respiratory infections in up to 13% of everybody that takes budesonide. So if you've been diagnosed with a lifelong condition called celiac, if you've been recommended budesonide, 1 in 10 of you at least will develop respiratory infections from the drug called budesonide. Also read that 10% of you, 1 in 10, will also develop nasopharyngitis, nasal congestion, pharyngitis, allergic rhinitis, runny nose, viral upper respiratory infections, cough, hoarseness. Those are just published. 1 in 10 are going to develop this. These are common side effects of budesonide, which is a steroid. Also, they published that 1 in 10% of all people will develop a moon face or decreased blood cortisol. And we're just showing you what that looks like, adrenal insufficiency. You see the actress on the right. You see her with adrenal insufficiency, causing a moon face on the left, and what it looks like afterwards, what it's supposed to look like without the moon face. It is reported, I want to highlight this under the picture, that death occurred due to adrenal insufficiency because of budesonide. 1 in 10 people will also develop oral candida, which if you look at the bottom left image, yellow fungus growing on your tongue as a result of budesonide. Next time you're going on a blind date and they want to kiss you, you might want to ask them if they're on budesonide and if they got that yellow, nasty tongue. All right, some of the other published side effects of budesonide, the most common are 21% of all people, 1 in 5 will develop abdominal pain. 13% of them will develop nausea and want to throw up. 1 to 10% will develop viral gastroenteritis, intestinal virus symptoms. Look at all those symptoms. When you got celiac disease, you're already worried about your bowels. Look at the whole list of bowel symptoms that 1 in 10 people will experience on budesonide. 28%, that's 1 in 3 of all people to prescribe budesonide for celiac disease will develop headaches like migraines. And you won't even know it's being caused by the drug you're being prescribed. 1 in 10 will develop urinary tract infections. It's not bad to have bowel issues and bloating and diarrhea from celiacs and gluten. Let's add urinary tract infection symptoms to the mix. 1 in 10 will develop that. Did you know 1 in 10 people on budesonide will develop mood changes, sleep changes, and insomnia? Psychosis has also been published to be a serious side effect of budesonide. Depression, aggressive reactions, mood swings. Did you know it's very common that you'll have muscle spasms that are involuntary in 1 in 10 people on budesonide? And take a picture, take a look at the image in the bottom right-hand corner. Cardiovascular risks, very common. Budesonide causes peripheral edema in 1 in 5 people. You'll get edema, swelling of your legs and arms and hands. And then high blood pressure in 1 in 10, 12%. Ask your doctor if high blood pressure and pitting edema are right for you when they prescribe budesonide. And then for those with celiac disease, if you're put on budesonide, 1 in 10 will develop conjunctivitis, which is pink eye. 1 in 10 will develop acne that they don't want. 1 in 10 will develop eczema and contact dermatitis, which is a rash and itchiness all over the body. Not sure that's better than just having celiacs. So what's the alternative? If it's just steroids and budesonide they can offer you and a gluten-free diet, let's look at things that they have published can help to improve gastrointestinal disorders, including celiac disease. And we're going to start with black cumin seed oil, otherwise known as Nigella sativa, which is the first ingredient in our biodefense product. We introduced biodefense to help the E. coli bacteria, Enterobacter bacteria, and yeast issues and shedding of the Nigella sativa oil is also published to improve celiac disease, which is the first ingredient in biodefense. How exciting is that? Also, biodefense ingredients are also published to be a cure for the bird flu, which is why we are very excited about this product. Not only for COVID vaccine and those worried about being shed on. If you've been vaccinated for COVID, you should be on biodefense. If you're worried about the bird flu, you should have biodefense in your medicine cabinet. If you have psoriasis, you should be using biodefense to cure yourself as an antidote. If you have celiac disease, you're about to learn why it is you should be on biodefense orally. 2 capsules full. A dropper fits into 1 capsule, empty vegetable capsule. I don't recommend swallowing this in your mouth. It tastes gross. These plant extracts are potent. But let's learn what Nigella sativa oil does for gastrointestinal diseases. Increasingly used as a spice in kitchens around the world, black cumin seed oil, due to its immunomodulatory properties, its immune system supportive properties, has potential applications in the prevention and treatment of many conditions accompanied by chronic inflammation, of which celiac disease is one. There is ample evidence of black cumin seed oil having anti-inflammatory, anti-parasitic, cholagogic, whatever that is. I actually looked that up. I've never seen this word before. I looked it up. Cholagogic, that means moving bile out of your liver into your gallbladder and into your intestines. Hepatoprotective means liver protective, and anti-ulcer effects. So if you have ulcers, intestinal ulcers, black cumin seed oil and biodefense are right for you too. Positive effects from its use, black cumin seed oil, were also observed regarding improving lipid profile, which is cholesterol, and body composition parameters, losing weight, shrinking your waistline, in patients with type 2 diabetes and liver steatosis, such as body weight and waist circumference, making it useful for the specific prevention of metabolic syndrome. Metabolic syndrome, if you remember, is 3 categories of symptoms: an increased waist circumference, increased high blood pressure, and increased blood lipid profile, increase in cholesterol. Therefore, they mention here, it seems reasonable to include this ingredient in the diet as an element of therapy supporting the treatment process, including drug treatment for celiacs and gastrointestinal disorders. These are the studies in which black cumin seed oil was used. And I just want to highlight out of this research study what else black cumin seed oil has been published to help fix. For the stomach, those with acid reflux and acid reflux disease. Did you know that black cumin seed oil, found in Biodefense, first ingredient, has been published to reduce gastric acid secretion? So that can help you with GERD symptoms, gastroesophageal reflux disease. Enhancement in ulcer healing, decreasing in white blood cell invasion. It's also a potential anti-H. pylori properties in humans, so it can help to reverse gastrointestinal diseases created by H. pylori bacteria. It's also been shown in type 2 diabetics, Nigella sativa oil has anti-cholesterol levels. It helps to bring down high cholesterol levels. And it lowers blood sugar levels. It's hypoglycemic effects, which is amazing. It's also been published in studies to help reverse pancreatic cancer. Several mechanisms underlying apoptosis of pancreatic cancer cells were described regarding thymoquinone inside of black cumin seed oil. That's what the TQ stands for. The liver, the second research study down there below, it also, black cumin seed oil, increased the levels of antioxidant enzymes, decreasing liver enzymes in your blood work of AST, ALT, and ALP. Also lowers lipid peroxidase, which is great. It lowers body weight, lowers inflammation markers in the body. Black cumin seed oil has also been established to help with hepatitis C viral load by reducing hepatitis C viral load and inhibiting its replication. It's also been found in the intestines to overall support, improve both the enzymes, non-enzyme parameters, and antioxidant defenses of the intestinal mucosa, which is directly correlated in celiac disease. It's increased intestinal glutathione stimulating hormone, and carolase levels were observed with black seed oil supplementation.